Thanks so much for taking time out of your busy day to meet with me. Can you tell us a little bit more about where we are and your role here at the Pennsylvania SPCA?
We're here at the SPCA Animal Shelter and Hospital, and this is where we do the magic work of saving the lives of the animals that come here.
And how long have you been in shelter medicine?
So I've been here at the Pennsylvania SPCA for about a year and a half, but I've been working with animals for about 20 years.
Awesome, thanks so much. Can you give us a tour here of the shelter hospital?
Sure. So over here we have some of our cats that need a little bit more medical intervention. When we have some cases that come in with smaller dogs, we'll have some smaller dogs that need medical interventions.
Can you share more about what type of medical interventions you and your team do?
So this is an ACT case from ACCT in the city shelter. This was an emaciated dog. She actually needed a transfusion. And so because she needed a lot of monitoring during that, she stayed in the shelter hospital for that monitoring, and we're just keeping a closer eye on her. She's probably about ready to move out into our dog room, but she's been kind of quiet.
And how many animals do you and your team treat annually here at the hospital?
We treat about 3,800 animals every year.
So can you share a little bit more about what Parvo is and how it affects dogs?
The main thing that we see with Parvo is going to be any sort of gastrointestinal upset, mostly with diarrhea, because that's where the Parvovirus replicates inside of the GI tract. There's little villi that come up, and then it settles inside of there, replicates, and then it just kind of shoots out the back end, and we hate to see that. So whenever we see these puppies come in and they have diarrhea, usually it ends up being very darkly colored. Sometimes they end up having blood in their stool as well. Sometimes they look pretty normal and we don't know for a day or two. So when we get puppies in here, sometimes we'll end up testing them from the outset if they don't have any vaccine history, if they look a little suspicious, depending on what we're seeing with those puppies. They can have vomiting, inappetence, lethargy. They can be dehydrated. They can just kind of look a little off. Sometimes when you're dealing with like an experienced tech and you kind of look at them and you're like, there's something wrong with this puppy. So yeah, we'll test them. And then there is kind of a misnomer sometimes where like, oh, it's a faint positive, but like a faint positive is a positive.
Right.
So then into GI isolation they go, and then we'll start treatment right away. Elanco didn't come out with the monoclonal antibodies until 2023. So until then, it was mostly supportive care with IV fluids and just trying to make sure that they were eating. It can be, you can let their GI tract rest for about 24 hours, but with these puppies, they can decline pretty fast. So you do want to start that syringe feeding, kind of get them eating again. Start with GI supportive medicines, on Dancitron, stuff like that. But with that, sometimes they still aren't making it. With these monoclonal antibodies, we see the incidence of survival skyrocket. We barely lose puppies anymore now that we have those on board.
That's amazing. So you told me before we started filming that you actually had some of the antibodies.
Do.
Could you go ahead and show us?
Keep them in the freezer.
Okay, that's perfect.
So this is what they look like. This is great. I've never had the chance to use these myself, but I've helped other people use them. And so once you open one of them, you do have to use the single vial itself. And it's like 1 vial per puppy, I do believe. And this isn't open yet, so.
By weight, so they might.
Yes.
Yeah.
But like once the vial itself is
Right.
open, you can't reuse that.
Right.
So, yep. And we're very lucky to have this and have the.
Hi, this is Christina DiBartolo. I'm the Director of Grants and Development Operations here at the Pennsylvania SPCA. I hope you enjoyed our tour of the shelter hospital. I figured I would wrap up this video. I'm still here at our Philadelphia headquarters on Erie Avenue, upstairs in our administrative offices. I just wanted to say thank you so much for the opportunity to submit this request for this life-saving medication for our Parvo patients. As I mentioned, when we first asked about submitting for this micro grant, just by a little bit of context on the cost for this medication. So once again, this is the Canine Parvovirus Monoclonal Antibody medication, which was released by Elanco in 2023, as you saw in the video. And for the package that you saw in the video is 6 vials. And so for the cost of 6 vials is $990. So depending on the dog's weight, they might need either 1 or 2 vials per treatment. So if they're a larger puppy or a larger dog, obviously they would need more than 1 vial. But the support for this really does go such a long way for our animals. As you saw in the earlier portion of this video, and I was talking with other staff downstairs who work in our shelter hospital, and they were saying how this medication really is a game changer for them, just in terms of the confidence that the dog would survive. Parvo is just astronomically higher with this medication. Not only that, but just the amount of staff time in order for the dog to be in our hospital recovering is just way less, so it frees up space for more animals, for us to be able to take in more animals that might need our treatment. So again, we're just so grateful, and we appreciate you considering this request.